Ultimately, it is the Department of Children and Families who is responsible. And if it's not happening with our contract agencies, it is our responsibility to make sure that it does happen. After all, I believe that once a child comes into care, we are the parent of that child while they're in our care, and we must act as such. We must ensure that we provide the proper oversight and guidance. Together, we are the parent of each of these children. We need every person at every level of this organization, from the top of the department to the front lines of our community partners, to be alert to the signs of problems, to apply common sense, and act with a sense of urgency. A sense of urgency that Gabriel Myers needed and deserved. You see, Gabriel Myers couldn't wait for a better system. I don't believe any of our children can. They need us right now. Someone once said, "Paint me with all my warts and molds." Well, that's the way I want you to see this department, our good points and our bad. In the last 2.5 years, there's been a dramatic improvement in child protection in Florida, and other states are now taking notice. Most of the credit goes to our community partners. We've safely reduced the number of kids in foster care by more than 31% in just the 2.5 years by providing a whole array of services and helping families so they can stay together. And we've done that safely. There are almost now 10,000 fewer kids in foster care than there were 2.5 years ago. We've set new records on the number of foster kids who've been adopted. And we're working hard to integrate our mental health, substance abuse, and domestic violence services, and to fully engage them in the care of our children. But the tragedy of Gabriel Myers reminds us how much more we have to do. Gabriel's face is up there on the screen, and he's watching us to see how well we've learned from his life and his death. We cannot let him down. I pledge to the legislature, and I've talked to the leadership of the legislature yesterday and today to update them, and I pledge to the people of Florida that we will get this right. They should demand no less of this department. Thank you, and I'd be happy to take any questions that you might have.
How would you respond to the contention that children at this age shouldn't even be on psychotropic medication?
Well, first of all, let me say I'm not a psychiatrist, and I am not anti-medication. But I have serious questions when it comes to the administration of psychotropic or drugs to children. I think it should be done as a last resort after full review by the appropriate kind of medical professionals. And what I indicated was that we've got to get the data right, and we've got to meet the statutory requirements. But none of that goes to the whole issue of whether these drugs should be administered in the first place. And that's an issue that I don't want to prejudge. I've asked the work group, and I think there's appropriate kind of talent on it. We've had appropriate input at the first meeting that was held in Fort Lauderdale. There'll be another meeting next Thursday. But we've got to do this in a serious, deliberative fashion. And I'm looking forward to the results of their findings and recommendations.
You have 13% of children in your care on these kinds of medications. Do you know what the percentage of children in the general population is?
Yeah.
It's about 4 to 5%.
And that, obviously raises some red flags, and it's some red flags that we've got to.
And one of the criticisms, I guess, is that these drugs are being used as a way of restraining children.
And that is clearly a concern that I've had. It's a concern that I've raised with our review group. These kind of medications should not be done for the convenience of the parent or the foster parent. They ought to be done because the child is in need of the medication. And that ought to be done by appropriate kinds of medical professionals. Also, I think it has to be done where a therapist is involved, particularly if there's a change in medication. And with the case of children under the age of 6, the legislation in 2006 required a second-party review. And what happened when that second-party review went in, as I understand it, is, and if you look at the stats, children 6 and under, there's a dramatic reduction, and that dramatic reduction came after the second-party review. And I'm not going to prejudge this, nor am I going to recommend it today, but maybe we need to look at a second-party review in all cases.
So these 2,600 kids that are now on this therapy.
Is each case going to be reviewed for appropriateness?
Right. The first thing we're going to do is review each case as it relates to those where we don't have parental consent or a judicial court order. As it relates to the remaining, what I really want to do is get some full recommendations out of the work group. Now, this work group is not going on forever. This is not going to be a typical governmental work group that reports back, next Christmas. So they're going to complete their review probably this month, maybe into July. And we will take the appropriate kind of actions after that. It may require some statutory changes. I've discussed it both with Representative Abishan and Senator Storms, who are waiting for the recommendations of the work group.
Besides the raw numbers of X number of kids that didn't get proper consent, have you gotten any explanations, any excuses, any reasons why the consent was not obtained for these kids?
I don't think there's any excuse. The statute is clear. It is very prescriptive in terms of what the statute requires. It is inconceivable to me, after all the attention that was focused on psychotropics over the last decade, but particularly in the year 2006, that the system doesn't have this right yet.
Well,
And let me say, hopefully something positive can come out of what happened to Gabriel.
how much responsibility is on the prescribing physician? I mean, don't doctors know that when they're dealing with foster kids that this is required?
Doctors should know. I don't want to cast aspersion on every single prescribing physician out there. But I think whether they know or not, it's our responsibility through our community partners to make sure they know what the statute is. We cannot, doctors cannot just be, casually prescribing these kind of drugs. I think one good thing that's come out of Gabriel's death is there a lot of attention right now in the psychiatric community on the administration of these drugs to children, as there should be. And if they don't know the law today, they haven't been reading your papers.
Is this maybe a budgetary issue? Is this something where more money, more funding, more oversight would have helped, or is this strictly just good oversight?
I'm not going to, get out of it that easy. This is not a budgetary issue. The legislature was very good to us this session. Not only did they not cut child welfare this session, there was actually a slight increase. They fully funded adoption maintenance. With the federal money, we now have the ability to fully fund independent living. They did not do the cuts in mental health and substance abuse. So this is not a budgetary issue. We ought to be able to get this right, and I'm confident we can.